providing me an opportunity to share my opinions in this session. I show my gratitude to Kerala State Specialist Medical Officer Association for representing me to present on this session. And I am highly grateful to the Indian System of Medicine, who is the mother institution for us. The perspective of Ayurveda contribution in medical arena. So we have gone through many of the points till now. I would like to take my session more towards the illustrative thing. Ayurveda, when it is spoken of, it is highlighted as a preventive medicine, but still it's a very wonderful curative medicine. So how Ayurveda can be more curative oriented one is the challenge for the next decade among the fraternity of Ayurveda. Ayurveda is a wonderful specialty oriented clinical healing therapy, which has to be excavated from the gems hidden in the text of the Shastra to be practically applied on the healthcare system with a proper methodology. And this methodology has to be very, very scientific and simple and reproducible. This is what we need to do in the next decade to excavate or explore Ayurveda for the maximum. And to do this, what we need is 4 points in clinical concept. One is we need to have prolonged prospective clinical follow-up of the same cases in Ayurveda. We need to go into deep of each and every clinical case, and we need to find out the risk factors far in advance, both so that the preventive aspect is appropriately administered. And fifth and the most important thing is to discriminate where Ayurveda works and where we need to just hold back our science and leave the patient to the appropriate system. So these 4 points have to be methodically developed, and that has to be made educated among the Ayurvedic practitioners and the academicians, which helps in the evolution of Ayurveda towards the modern health system as a very best and effective health system. So I would like to make this presentation as industrious. So I would like, I'm indebted to ISM who have developed so many specialty clinics. To bring in such kind of things, we need specialty clinic and specialized approach towards clinical condition with a holistic perspective. So we differ from the specialty clinic department that our approach should be holistic, but we need a specialty clinic and specialized approach. So ISM department has created many kind of specialty clinics, and many specialty medical officers have been assigned these specialty clinics as well, along with other medical officers. And let us see how it can be done to create a data generated genesis with the context of even the Premiha specialty medical office means clinic, which is running in ISM at 4 centers. I would like to give some of the ideas how Ayurveda brings in wonderful changes into the medical system. So when it comes to when we go for the clinical conditions, we know that Ayurveda is very well known as a wellness clinic or a preventive the concept of medical system. It is very, very effective in chronic degenerative conditions, chronic life-threatening conditions, of course. But what we need to highlight is Ayurveda is a very, very effective system in lifestyle-related disorders. And that is understood, but we need to develop Ayurveda as a mainstay line of treatment for such kind of lifestyle disorders, not just as an add-on treatment. We need to develop a mainstay line of treatment for clinical conditions like diabetes, hypertension, hyperthyroid disorders, etc. Such kind of chronic conditions. Ayurveda should emerge as a mainstay line of treatment, and specialty clinics, specialized approach treatment facilities is one of the major gateways for such kinds of clinical manifestation. Let us see. And second thing is that when we manage such kind of lifestyle disorders, we should be able to develop clinical skills and clinical methodologies, clinical remedies to give relief for all the problems they develop in the course of such chronic conditions. A diabetes patient, when they come to us, the controlling blood sugar levels is not the only only main line of treatment. Now let us see what are the complications they can get and how we have to approach them also. See, chronic diabetic case and hypertension is a major conditions will be the skin manifestations. Such kind of skin manifestations which they don't get relief in any other kind of health management, we can give wonderful results and through Ayurveda. So this is the diabetic carbuncles which got completely resolved within 6 months or 10 months. And then cellulitis which we hardly try to involve. We need to know what should not be done in such kind of cellulitis condition. And cellulitis is a case where we can do wonderful results and we can bring faster relief to the patient. So diabetic foot ulcers, patients who suffer from foot ulcers for years together, they can get good results with Ayurveda. So this was one of the cases who had diabetic foot ulcers for almost 20 years and she got completely almost healed by 6 months of Ayurveda treatment. So then allergic dermatitis. So then there is a condition in diabetes. So the same conditions like diabetes, we are supposed to follow all the kind of clinical conditions and follow and try to make a specialized approach to multiple manifestations in one particular lifestyle disorder, chronic disorder. So we need a prospective follow-up, clinical follow-up and management. So we need a specialized clinic with a holistic approach of Ayurveda. So this is a kind of allergic dermatitis and angioedema developed in diabetes and this responds within 3 months of condition. And then, we another example for eliciting the risk factors far early in such kind of life-threatening conditions like diabetes. The renal compromise is the most complication. There is a complication of renal compromise, there is complication of cardiac compromise and the cerebral compromise and the less vascular microangiopathy. So, eliciting these conditions far in early and giving preventive medicine, this comes the role of preventive medicine as well. So there was a case also microalbumin. Microalbuminuria onset in a diabetic patient shows the far early sign of renal compromise and Ayurveda works wonders. There was a high case with presentation of 1058 with microalbumin and within 3 months of treatment it came down to 300 milligrams. So such kind of clinical specific approach. This microalbumin patient did not present to us with any kind of clinical condition, but these are the things which we have to elicit prior and treat it appropriately to avoid or to prevent the renal complication. So such is the condition approach which needs Ayurvedic physician to have a holistic idea and a holistic approach towards an Ayurveda, towards the clinical condition, and that with the Ayurveda principles, the approach should be with the Ayurveda principles will help the patient to give a complete holistic approach and prevent many of the complications, and cure many of the complications developed also. So this would be one of the cases where Ayurveda specialized approach will help in developing clinical evidences that which can give a great arena to the Ayurveda in the medical health system. This is one of the other cases where the patient himself observed lot of the differences what he experienced by Ayurveda medication. So the patient who came to this is a cardiac patient, diabetic cardiac patient following bypass surgery. That person had severe GGT. The liver enzymes was highly shooted up for almost 3 to 4 years. Renal failure, GFR was reduced almost to 40. And this patient, after not changing to Ayurveda, after adding on Ayurveda medicine, his GGT came down alarmingly from 581 to 129 within a span of 2 years. And the patient discontinued in between, and the patient himself noted that there is a deterioration in the GGT improvement and the renal function also. So he came back observing this kind of changes in his blood parameters, and he started Ayurveda by himself. So this shows how Ayurveda normalizes the systemic impairment and how it can be act as a protective health system in multiple systemic failure. or formed from this. So Ayurveda can have a curative aspect and Ayurveda can have a preventive aspect. Moreover, Ayurveda is the one area where we can avoid the risk factor. So these are all the research questions we have to take up, and these questions have to be changed to a module such that it can be educated to the academicians, to medical officers, to the students of Ayurveda, such that they are trained in such a way that they approach a clinical condition specifically, specifiedly, and then holistically. So we have to improve all these 3 points in particular patient. It is not simply regularizing the blood sugar levels in diabetes, it is seeing the complication, it is preventing the complication, it is curing the presenting complaints. All these 3 things should happen in all the lifestyle disorders or disorders or other conditions. So this is one of the conditions. The Ayurveda can exist these many kind of causative hetu visheshas in a simple condition of diabetes, lifestyle disorders, in simple condition of hypertension, in simple condition of hyperlipidemia, and it is only in Ayurveda such a kind of approach has been mentioned. And in such a kind of approach, without targeting each and every point of these hetu visheshas, there is no point in seeing only the blood sugar levels. This is the only science which can give so many variabilities to a single clinical condition, and that clinical condition can be leveled to an equivalent, a normal axis level by targeting these kinds of positive elements, and it will work certainly very well if we are able to elicit each and everything and rule out those kind of factors again in the patient. Now, not only in this kind of lifestyle related disorders, in severe neurological conditions where there is no answer in other medical systems, or they have less answer in other medical systems, we have very good answers. So that kind of areas has to be identified, and a clinical protocol has to be developed. It's not simply protocol. We don't have protocol for a clinical condition. We have a prototype for individual holistic persons. And that kind, see, this was a case of writer's cramp who came to me at the age of 22, who was a medical student, and he was not able to write his exam just because of this writer's cramp. We can see the changes in his handwriting, the stroke, the writing stroke, where he was not able to write many of the letters in the proper way. There was no linear arrangement of the sentences which went crookedly. But the same person, after 5 months of treatment, there was such a kind of enormous change in his handwriting, and this person was supposed to write his exam with a disability certificate from the neurologist, but he was able to write the exam and he passed just 5 months back.
Can you go fast? Can you go fast?
Okay. The same kind of condition we are back. This is a different clinical condition where as an effect of the overuse of statin. So we also like to try, our area is also to find out the drug abuse. The drug abuse is the most other second area where we need to act voluntarily. Most of the modern medicine drug abuse has to be elicited, how it has to be reduced. The more common thing is that the statin group of medicine, the tranquilizers, then the amitriptyline kind of medicine, and the medicines for the connective tissue disorders. These abuse itself is creating a lot of problem which we need to appropriately diagnose than diagnosing the disease. Most of the time the disease might be because of this effect. So this is also an area where specialized people have to, specialty clinic has to work in. And then other condition of chronic condition, thyroid stimulation, the thyroid condition, even a condition where the TSH as high as 145 can come to normalcy, but we need to wait. Only with the herbal medicine they can come to normalcy. Such kind of things also, there is no need to panic for us, but still we need to understand what is the clinical condition and then appropriately give. It also, Ayurveda is also works wonders in condition of rheumatic disorder, where we can see one clinical condition, the anti-CCP of 200 came down to 7.3 within a gap of 5 months. And as you all know, psoriasis is the area where we can do wonders, and
Not 15 minutes is over. Just faster.
Okay, fine. So that winds up the section. So I would like to say that what we need is a specialized approach with a specialized thinking, but a holistic concept. So with this, we will be able to educate our students. We need to educate our students for the next decade in such a way that they will be able to see clinical conditions prognostically, deeply, and prevent the risk factors as well. So that is the need of Ayurveda presently for the development. Thank you, one and all.